Hi everyone, this is Divya from Quickmommyhacks, and today I'll talk about my 11 C-section recovery tips. So, number one is skin to skin. So, always demand to have your baby be kept skin to skin immediately after your C section surgery or at least within 30 minutes. Skin to skin is really beneficial for the baby's physical, emotional, and social development, and also it also encourages breastfeeding. So, it's really, really helpful. If you are not able to have your skin to skin contact with your baby immediately or within 30 minutes, then you can also have your partner do the skin to skin contact, and then you can do the skin to skin contact and also try to feed the baby whenever you are awake. Number two is breastfeeding. So, whenever you are awake from your anesthesia, you should try to breastfeed your baby if you're able to. If you're not able to, then the other alternative is that you can try to pump so that you can try to stimulate your milk production. So, that will actually help eventually in the longer run, because sometimes it's very hard for C section moms to actually produce milk right away. It can take some time. Also, another thing is that breastfeeding really promotes the contraction and healing, and it is often a challenge for C-section moms. So, one of the positions for C-section mom while they're breastfeeding is the football hold or the laid back position, which really helps them. Try to have a lactation consultant or a nurse help you while you're doing it so that you can find that effective latch for the baby, because that's really, really important. You can also try to have a nursing pillow to get that support while you are trying to breastfeed. My favorite one is the My Breast Friend nursing pillow, because it has a strap which goes around your waist and you can tie it, and it's really good for women who have had C-section. Number three is to get walking in the hospital. So, although you would be in a lot of pain and you would be on pain medications, but try to have those small walks in the hospital to improve that circulation and also prevent the blood clots. So, it's also possible that you would have a lot of swelling. Immediately, like after your C section, at least it happened with me. So, the walking actually really helps with the swelling as well. Number four is abdominal binder or a compression belt. So, abdominal binder or a compression belt is a belt which goes around your abdomen, and it helps in promoting recovery after C section and also helps to keep everything in place. There is often a debate about how helpful they are. It helps some people and some people it doesn't. So, at least for me, it was helpful because it actually helped support my belly a little bit and also, kept everything together. So, it was helpful that way. Number five is to sleep with your legs raised. So one of the major problems that actually happens is edema, which is, swelling of your legs and feet. At least it happened with me, and mine was kind of really severe. So what really helped me during that time was actually to help, to keep my legs raised, and also most importantly, reducing the salt intake, because it really, really helps in improving that swelling or edema. So, number six is to protect your incision, keep it dry and clean. So, if you're taking a bath, and even if it's in the hospital, you can try to use a mild soap and water and keep that area dry, and then, clean it properly. And then, most importantly, is that in order to protect your stitches, yeah, the incision, and if you're laughing or coughing or sneezing or doing any of this sort of an activity which can put a lot of pressure on your incision, you can try to hold your incision with the help of a pillow, which will help protect it. And just overall in general, try to keep that area as clean as possible and as dry as possible. So, number seven is to conquer constipation and empty your bladder. So, after C section, gas, pain, bloating, constipation are very common. So, you can try to have those stool softeners in order to ease up your bowel movement. And also, you can try taking probiotics, which actually helps in improving the gut health after surgery. And try to empty your bladder to ease up that pressure on the wound. Number eight is at home care. So, when you are back home, it's very important that you take extra care of your incision and extra care of your health, because you will still be in a lot of pain. So, it's very important to take as much rest as possible. So, avoid activities such as driving or lifting something heavy, more heavier than your baby. That's actually not recommended. And driving, climbing stairs, and so on. These are the activities which are actually not recommended, in the first week at least. least. You can start by walking around your room a little bit and then expand on it by taking a walk around the block or something, but you just wait for it a little bit and try to take as much rest and all your pain medications that you're prescribed and as much sleep as possible in order to heal much better. Number nine is emotional recovery. So, emotional recovery means basically a lot of new moms, of course, go through baby blues, almost 80% of them. Some of them go through postpartum depression or postpartum psychosis, even. So, take note of your mental health. Just pay attention to your mental health. Also, it happens a lot with C section moms, especially if you have had emergency C section, that you might feel cheated. You might feel that you prepared for a normal delivery but it didn't end up like that. So you might feel actually really low at that point and you might feel guilty. So if you're having any sort of these feelings, if you're having any kind of mood swings, or if you're feeling really sad, lonely, or the symptoms that indicate baby blues or postpartum depression, then try talking to your family, your friends, and your partner, most importantly, and seek help as required. Number 10 is to eat healthy and stay hydrated. So, recovering from a C section takes a little bit longer compared to vaginal delivery. So, it's very important that throughout the period you are resting, you are taking care of yourself, and you're eating nutritious food as well as staying hydrated. Number 11 is walking and exercising after C-section. So when you're at home, try to have daily walks. You can start by taking walks within your house, within your room, and then you can build it up slowly. By around 2 weeks, you can start having slightly longer walks around the block, maybe. And then after 6 to 8 weeks, after consulting with your doctor, once they say that everything is okay, then you can even start doing light exercises, which also help in the recovery process.
Well, this brings me to the end of this video. Thank you for watching. If you like the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram for some personal tips on pregnancy, childbirth, and motherhood. Also, do leave your feedback and feel free to ask questions in the comment section below.